Good evening, everyone. We once again welcome you to the Dr. Prax Health series. As a part of the Dr. Prax Health series, we bring to you discussions on important health-related topics with renowned specialists in these fields. Today, we have with us Dr. Amol Rege and Dr. Chaitrali Gupta. Dr. Amol Rege is a renowned spine surgeon and orthopedist and has an experience of over 22 years in these fields. He practices at his orthopedic and spine specialty clinic on Law College Road in Pune and is also attached to the Dinanath Mangeshkar Hospital. He has completed his DNB from the National Board of Education in New Delhi in 1993 and his master's in orthopedics from the University of Bombay in 1992. Welcome, Dr. Rege. We also have Dr. Chaitrali Gupta. Dr. Chaitrali Gupta is a renowned physiotherapist based out of Pune. She has been practicing for over 11 years at the Orthopedic and Spine Specialty Clinic on Law College Road, along with Dr. Amol Rege. And she also practices out of the Aspire Clinic at Baner in Pune. Welcome, Dr. Gupta. Today, they will be covering many interesting topics related to the spine. And all of us have been grounded at home, working from home due to the pandemic. And a lot of us, we've heard of a lot of cases where people are talking about issues with back pain, with spine-related issues. And these topics will be covered in detail by Dr. Rege and Dr. Gupta. Welcome, sir. Welcome, ma'am. I hand it over to you to get started. Thank you once again for joining us.
Thank you, Vinita.
Thank you, Vinita.
Thank you, Vinita and Dr. Prax for providing this platform to increase the awareness of spine problems, especially in this current situation where we are all forced to work from home with COVID-19 pandemic situation. I'll just share my screen to start with the talk. So basically, I'll be focusing on the problems of work from home, the back-related issues, the neck-related issues which you get due to working from home. So in my talk, I'm going to cover some basic aspects of the structure of the spine. How should one take care of your own back and neck? Basic ergonomics. How should your posture be when you work from home? What exercises you need to do? What diet you need to follow? I will also describe some common spine disorders, things like degenerative disc disease, what is sciatica, what is osteoporosis, and what are the current minimally invasive treatment options. This is basically to increase the awareness of spine problems. Actually, recently on 16th October, we had the World Spine Day, and this is an ideal time to discuss about the spine issues. So because of COVID-19, work from home is going to be the new normal. I think there was work from home in certain industries, but with COVID-19, we were actually forced to work from home, and most of the industries have extended till the end of the year to work from home, and maybe it may become the new normal, especially for majority of the employees. You must have read in newspapers about various surveys which have been done, and you'll be surprised that majority, more than 2/3, prefer to work from home. There are obvious advantages that you don't waste time traveling, and there is a big advantage, when you work from home. But one has to remember that work from home does not imply only to the working professionals, middle-aged professionals, but now even schooling is work from home. You're schooling from home, and even elderly people are managing their activities on the net from home. So it actually applies to a broad age group, right from the toddler to the elderly. And all of us have to take care of your spine so that we don't get problems of neck and back in the long run. Now, there are certain problems of work from home. And again, these are some newspaper cuttings which I have put in, that neck and back pain may become the new normal. So it sounds very drastic, but this can be a problem if you don't take care of your back and neck. And actually, it is described as the pandemic of work from home injuries. Because of long sitting hours, improper posture, neglecting one's own health, growing fatigue, all this can lead to a lot of problems of your neck and back. So what really happens is that when you're in an office atmosphere, you have ergonomic workstations, you have ergonomic chairs, you have a desk, and also there is social interaction, there is less perhaps stress. And then suddenly, since March this year with the pandemic, we are all now forced in a situation where we are up at home in a cramped up space. We don't know what to do, how to sit, and we are just trying to adjust to this new normal. So in this lecture, I perhaps will try and emphasize as how should you adapt to this new normal? How should you take care of your neck and back? So this change in and working environment has been the biggest problem for those who are working from home. Now, obviously, once you're at home, there is a lot of independence, and that has its own advantages, but it has also disadvantages. You may sit in a stoop posture, or you may lie down on the bed and use your iPad, and all this can cause injuries to your neck and back. So it is very important that you don't take this independence in the wrong way and hurt your neck and back. Taking care of your spine is very important. And why it is important, I'll just show you this video. I don't know whether all of you know this, but he's Fauja Singh, who is a marathon runner. At the age of 90, he has completed Canada, London marathons. And basically, life is motion and motion is life. And if you want motion, if you want to live up to that age with that amount of mobility, you need a good functional spine. So a strong spine is crucial to your health. But unfortunately, we don't take care of your spine, and back pain is a curse for this century. You'll be surprised to know that it is only second to common cold for which patient seeks doctor's advice. It has been described as a medical disaster of 21st century. And all of us do suffer back pain at least once in a lifetime. All the celebrities, including the god of cricket, Sachin Tendulkar, has suffered from back pain. But fortunately, though 35 to 40% of adults get back pain, only 1% will get permanently disabled. So you don't need to get really afraid of back pain. You need to understand that if you don't take care of your back, you will have back pain. But with simple treatment, you can overcome this back pain. To understand more about back pain, let me describe some basic structure of spine. So the spine has 33 vertebrae. There are 7 in the neck area called cervical vertebrae. There are 12 in the thoracic area, that is the chest area. There are 5 in the lumbar area, that is the low back. And then the sacrum is 5 vertebra and the coccyx are 3 vertebra. So totally we have 33 vertebrae here. And it is very interesting to know, you all think that the spine is a straight structure, but it is not a straight structure. It is a S-shaped structure. There's a gentle S curve, as you can see in this diagram. And it is very interesting to know how this curve developed. So in our evolution, from quadruped, we became biped. So from bearing weight on 4 legs, we became bearing weight on 2 legs. So the spine, which was C-shaped, eventually became S-shaped. And it is also interesting to know how human beings develop this curve. So when we are in the womb, we are like a C. And once the child starts lifting the head up, the neck curve develops. The child starts sitting, the thoracic and lumbar curve develops. And when the child starts standing at the age of 5 to 6 years, you get a complete S shape with the cervical, what is called as lordosis, thoracic kyphosis, and lumbar lordosis. So it's a gentle S-shaped curve. Sometimes people get afraid, seeing on the X-ray that their spine is curved. Don't get afraid. This is your normal curvature. Now, in between these bones, we have something called as a disc. The disc is a load-bearing structure. It is like a tire. It is a shock absorber. Our daily stresses of life are absorbed by this disc. The disc has two parts. The outer part is called as annulus fibrosus, and the inner part is like a jelly, like a air in the tire. It is called as the nucleus pulposus. And sometimes this jelly can come out and impinge on the nerve and give rise to nerve pain, which we call sciatica, which I will discuss later. Now, our spines are not like a straight bone. They are flexible. There is movement which is occurring. And this movement occurs in three parts between the two vertebrae. One is the disc between the two vertebrae, and the other is the facet joints, which are on the side, the small joints. So because of that, we can bend forward, we can turn sideways. So that is the advantage which we have in the spine. The maximum load in the spine is when you bend forwards, as you can see in this diagram. When you bend forwards, the load is very high. So bending forwards and lifting weights is the worst thing you can do for your spine. Now, obviously, sleeping is the best position where the disc pressure is less. But one cannot sleep all the time. So there are postures which you need to know to take care of your spine. Now, what moves these bones and joints are the muscles. Now, the long muscles look very attractive. You know, you do gym and you build up these long muscles, they will look very attractive. But what is most important to prevent back pain are the small muscles. These are very short muscles which run between the two vertebrae. They are called as multifidus muscle. This muscle is more important than the long muscle. And simple back exercises, brisk walking will help to develop these muscles. It is not really the weight exercises in the gym which will help to develop these muscles. And if these muscles are strong, they can take the load off the disc and prevent back pain. So when a patient comes to us with back pain, we categorize them into one of these three groups. One is the mechanical pain. Now, most of us who get back pain, I would say almost 70% fall in this mechanical pain group, where the pain is in the low back, it is aggravated with activity and relieved with rest. There are no leg symptoms. There is a second group of patient, which is the nerve root pain. So the pain is because of the pressure on the nerves. So the patient complains of pain in the legs. There is tingling, there is numbness in the legs, difficulty in walking. So this is the second group. And maybe 20-25% of the patients which we see belong to this group. And hardly 5% will have serious spinal pathologies like infections, tumors. So I'm going to focus my talk mainly on the mechanical low back pain, which most of us are likely to suffer if we don't take care of your back when working from home. So as I said, mechanical back pain is the pain is only in the low back and aggravated with activity. There are no leg symptoms. So what is the cause of this pain? This is the normal disc which you can see. And this disc degenerates because of improper care of your back. So because of the daily loading, the stress, the bending, the disc degenerates, it creates chemicals, and this causes spasm and pain. The main risk factor is improper posture. Working for long hours in this sort of posture predisposes a person to back pain. The other important cause is improper diet. While working from home, if you binge on pizza, burgers, unhealthy food, you're going to become obese, put more load on the disc, and that is going to cause back pain. So it is very important that you understand this and take care of these risk factors. And I'll speak in the next few slides as how you can take care of these risk factors. The other risk factors are a mentally stressful job, a sedentary lifestyle. Now, when you're working from home, I'm surprised actually a lot of my colleagues who work in the IT profession tell me that their work is much more than what they used to work in the office. So if you're working for long hours and don't find time, you're going to get stress. Your lifestyle is going to be sedentary. You're going to become anxious, depressed. The work targets which are put on you are going to be a problem. And this can be, again, a very big risk factor for back pain. Besides that, smoking, strenuous physical exercises which are not done properly, strenuous physical work, if you're helping your partner at home, lifting weights in improper fashion, it is going to predispose you to back pain. Now remember that prevention is better than cure. You take care of your spine so you don't have to see a specialist like me. And the most important is the right posture, reducing stress, a healthy diet, keeping your weight in control. Even in corona situation, you can still find time to do regular walks, at least half an hour of brisk walks or light jog, and regular exercises. You don't have to do, the gyms are closed. You don't have to do, extensive exercises in the gym, but you can do plain simple exercises, which will show you a video to prevent back pain. So the most important is the posture, standing erect, sitting erect. You should not be in a stoop posture. You should not be standing or sitting in a stoop posture with a hunch, because that is going to put stress on the disc, as we saw before, and cause back pain. If you sit in a stoop posture, if you bend and lift weights, the whole force will be acting on your spine and will cause you injuries. And over a period of time, that is going to aggravate the wear and tear in your back and cause you pain. So most important is workstation ergonomics. How you sit at home is very important. You need to create your own workstation place at home. Find a place where you can put a good chair, you have a good desk, you have space beneath your desk. As you can see, this man is sitting with a lot of clutter underneath the desk. So he can't slide the chair ahead. So he has to work away from the workstation. He's sitting in a stoop posture, so that is going to cause him problems in the long run. This lady in the slide is using the phone all the time, and that is going to give her neck problem. So if your usage of mobile, if your usage of desktop, laptop is at an improper height, it will give you problem. You can think of alternate workstation called a standing workstation. So again, you don't use a standing workstation for prolonged hours because it can give you lower limb problems. But it is a good as a breakup from continuous sitting. So you can find some time of sit, do a standing work, again sit to your workstation desk as this lady is doing in this slide. Now I'll show you a video as to how you do, basic ergonomics at home.
Hello everyone, I am Chaitrali Gupta, Physiotherapist from Aspire Physiotherapy Center, Bani, Pune. I thank Dr. Amol Rege sir for giving me this opportunity to provide you all with the work ergonomics while working from home. So let us see how well we can set up the workstation so that we don't stress our spine. So you can prefer using your laptop table if you have, or the dining table is ideal. I'm here preferring the dining table, or even the iron standing board you can prefer. So you have to always see to it that your back is well supported. If your feet are hanging like this, if the knee is getting lifted, always see to it you put a garter, or you can use a support like this. Pull the chair in front, then just see to it that the screen is 90 degrees to the eye level. So you can use a book like this, whatever according to your adjustments need to be done. The pile of books can be fixed. Now you have to see that you cannot type this way. So you always strain up the neck muscles. So always prefer using a portable mouse and a keyboard handy. So now you can use a small cushion for the lap. Keep your keyboard on it and the mouse. So now the neck is taken care of. So as your forearm and the arm angle is falling to 90-90 and the wrist is working efficiently. Now you have to see to it that you don't strain your eyes as well. So always see to it that you pull the laptop in front, just adjust according to the one hand distance. So now this is the ideal workstation for me. So this can be easily made at home. So you have to don't always need ergonomic chairs. So you can adjust whatever available resources you have. And always see to it that whatever optimal position you achieve, you have to take frequent breaks. So after every half an hour, you see to it that you stand, you walk, you stretch. So it eases more pressure from the spine. So stay healthy, stay safe, and take care of your spine. Thank you.
So Dr. Chaitrali has shown us simple tips of how you can design an ergonomic workstation at home. And I would suggest that maybe you do 2 or 3 sort of workstations at home, maybe one in the bedroom, one around the dining table. So you can change as and when required. The other common problem in the current era is texting neck syndrome. So excessive and misuse of mobile can lead to this neck problem. When you bend and use your mobile, the weight on your neck is almost 60 pounds. But if you use your mobile straight, it is about 10 pounds. So again, when mobile is almost like a laptop now, and most of us do our work on mobile. So you should know how to correctly use a mobile to prevent neck problems and cervical spondylosis in future. Now, you might be working from home, does not necessarily mean that you're always on the laptop, and your partner might request you to help her with things at home. So lifting weights, you should be able to know what is the correct way to lift the weights. So if you bend your spine, then that is incorrect. You should bend your hips, knees, maintain the curvature of your spine and lift weights. So that will prevent back pain. Also, sleeping position mattress, which a lot of people are interested. Use a medium firm mattress. Memory foam is good but expensive. Adequate space should be available. Single pillow, not too many pillows, otherwise you're going to hurt your neck. And pillow between the knees. You need to find time. However busy you are, you need to find time for your own body. Do yoga, do meditation, have a lifestyle change, make a routine, find 1 hour for your body, for your spine. Brisk walking is the simplest exercise you can do to strengthen your multifidus muscle, and that will prevent back pain. There are a lot of simple exercises. You don't need to go to a sophisticated gym. Gyms are nowadays closed, but there are a lot of simple exercises, and you can find 15 to 20 minutes from your busy schedule and do simple exercises for your lower back and some exercises for your neck. If you do the exercises improperly, it can be harmful to your spine. Now, Dr. Chaitrali with Dr. Ankita will demonstrate some basic exercises for your back and neck. They look very simple and you will feel that it is a waste of time. But these are the exercises which will help your back and neck in the long run. So it's a long video, but be patient and see this video.
So now we start with the demonstration of the exercises for the spine care. She is my colleague, Physiotherapist Nikita Kole, who will help us to demonstrate with the exercises. So these exercises...
Sorry.
So now we start with the demonstration of the exercises for the spine care. She is my colleague, Physiotherapist Nikita Kole, who will help us to demonstrate with the exercises. So these exercises can be done on the yoga mat or a firm mattress. So now you have to lie down straight. Bend both the legs. The first exercise we do, so in this, after bending both the legs, just see to it that the feet are apart. Now, first exercise is the pelvic tilt. So we have to go from lower, that is the lower abs, towards the chest. So drawing the lower abs in. Hold it, 1, 2, 3, 4, 5, and then release. So we just have to see to it, and one more we repeat. So do the tilt, 1, 2, 3, 4, 5 and release. We just have to see to it that we don't lift the lower buttocks. The lower trunk. This is not the pelvic tilt. We just have to draw the lower abs in. Move the pelvis in. Yes. 1, 2, 3, 4, 5 and release. The second exercise we go is do the lower abs, that is draw the pelvic tilt and now lift the trunk, lower trunk. Hold this 1, 2, 3, 4, 5 and now down. So again do the lower pelvic tilt and lift the seat. 1, 2, 3, 4, 5 and then down. Now we can engage the core by adding ball to it. So we can use a mini football or a football. Now do the pelvic tilt. Perfect. And lift the lower trunk. And squeeze the ball between the knees. And be gentle when you squeeze the ball. 1, 2, 3, 4, 5 and release. Again, one more. So do the pelvic tilt. Lift the lower trunk. And squeeze the ball gentle. 1, 2, 3, 4, 5 and release. So now bridging can be progressed with. Do the pelvic tilt. Lift the lower trunk. And squeeze the ball gentle between the thighs. Hold it 1, 2, 3, 4, 5 and then down. Again one more. Do the pelvic tilt. Lift the lower trunk and squeeze the ball gentle. 1, 2, 3, 4, 5 and down. In this, just see to it that you don't release the pelvic tilt when you go up and go down. You don't squeeze the ball too heavily between the knees. Don't hold your breath. Keep breathing normal. These are the precautions to be taken while doing this exercise. Then we do the next exercise with the Thera band. So if you have, this can be easily be available on the Amazon. There are levels of Thera band. So we start with level 1. This is level 1, yellow color Thera band. So in this, tie the Thera band to the thighs in this way, just near to the knee. Then we do the pelvic tilt, lift the trunk and gentle stretch the band and hold this 1, 2, 3, 4, 5 and then down. One more. Do the pelvic tilt, lift the trunk and stretch the band. 1, 2, 3, 4, 5 and down. So in this, we just have to see to it that we don't lift it too high. We don't stretch it too much. Yes, this way when we are. Okay. This is the precaution to be taken in this exercise. Next exercise we progress is to going into quadruped position. So in this, we go on both hands, both knees. Just see to it that your shoulder to hand is 90, that is in same line. Hip to knee is 90, that is in same line. And your hand to knee is 90. Yes. Now, draw an imaginary line from your navel to the ground. Also, one more precaution is that there should be no hump or no arch. The spine needs to be neutral. So this is the neutral spine. Now, in this position, we have to drag the knee backwards. So one at a time. So this we are doing on the left side. So just drag. So engaging this core. So mainly we have to see to it that the spine is not moving in this. Similarly, the opposite leg. So engaging the core, we have to see to it. We move the leg and release. The next exercise we progress with the thira band. So we can get a looped thira band, or you can use your regular thira band tied to the legs like this near the knee. Go into the horse position or the quadruped position. Just see to it again that your shoulder to hand is 90, your hip to knee is 90, hand to knee is 90, a nice distance is maintained, no arch, no hump, neutral spine is there. And now we move one thigh outwards. So move your left thigh out and in. Again out and in. And relax. Similarly on the right side. Yes. And move the thigh out and in. Out and in. Yes. So these are the mat exercise what you can do. So now we do next set of exercise on the gym ball as well. So this is a gym ball. We can get it on Amazon. If available at home, you can use it in this way. So first exercise we do on the gym ball is sitting straight, seeing to it that your hip to knee is 90 and your knee to foot is 90. In this, we start with the pelvic tilt. So draw the pelvis in. Hold it 1, 2, 3, 4, 5 and release. Draw the pelvis in. 1, 2, 3, 4, 5 and release. The second exercise we do is sitting straight, lifting alternate foot, that is called as marching. So lifting right and left, right and left. So we just have to see to it that you sit straight nicely. If you're not able to do with the hand on thigh, you can use take slight support of the ball. So your hand can rest on the ball and do the marching. 1 and 2. This way. So you can start with 5 rounds or 8 rounds and nicely progress up to 20. The third exercise we can do is with the dumbbells if easily available at home, or if not, we can use the water bottles. We can start with half a liter of water bottles in both the hands. You can fill the water and just take it. And now hold, sitting straight on the ball, take your hands forward. So it is just in line with the wrist is in line, the hand is in line with the shoulder. Your neck is not hold it stiff. Just breathe in, breathe out normally. Now in this, first we inhale and we take one hand up and exhale when you go up. And when you come down, inhale and take the opposite hand up and exhale. Now we can start with the neck exercise. So you can use your stool at home or any sitting armrest, without armrest chair you can use. So sit straight with the spine. Your foot should be supported on the ground like this, not back, okay? So your hip and knee is in same line. And now in this we have to do the chin tucks. In this chin tucks, what you have to do is hold your index finger to the chin and now move your head back side this way. 1, 2, 3, 4, 5 and then release. So in this, just see to it that you don't go back from your spine while doing the chin tuck, or neither take your chin up. not this. This is not the chin tuck. So what we have to do is index finger to the chin and just move your head backwards. 1, 2, 3, 4, 5, and then release. Okay. Then this can be added with the resistance using the Thera band. So the Thera band, what we use for the legs, we can use the same level of Thera band here. So hold it onto the head this way. So just slightly above the ear level it falls. And the hand is supported this way. That is 90, shoulder to hand is elbow to is 90 degrees, and the hands are apart. And now press your head on the Thera band. You just have to hold with the hands the Thera bands firmly. Hold it for 5 seconds. 1, 2, 3, 4, 5, and release. One more. So move your head back on the Thera band. 1, 2, 3, 4, 5, and release. Just don't do the error in this is too much of resistance, too tightly you're holding and moving it back. Just don't do that. Or too leaning back. So you just have to see to it that your spine is straight. Then we do the next stretch. So in this, you have to stretch the trapezius or the neck muscle, what we call. We have to bend the neck to one side, holding with your one hand, and now taking the hand which is straight on the opposite side, moving it towards the ground. Hold it for 5 seconds. 1, 2, 3, 4, 5, and release. So similarly, we have to do it on the opposite side and stretch it and move. 1, 2, 3, 4, 5, and release. These exercises, just see to it that there is no pain while doing any of the exercise. If so, you just hold that exercise. Get it learned from the experts and then kindly go ahead with the exercise. Thank you very much.
So these are very simple exercises. You can do it at home. Don't need a sophisticated gym. You need to take some time off between your work schedule. Maybe it's a good break after working maybe an hour. Do 10 minutes of exercises for low back. Another 1 hour you work, do 10 minutes of exercises for your neck. You need simple devices like the Swedish gym ball, the TheraBand, which you can order online. So if you're working from home, see that you have a corner in your room where you keep all this equipment. Make it your own local gym at home and take care of your back and spine. Now, once you get back pain, in spite of taking care, then you can try simple remedies at home, simple painkillers, ice, heating, stretching, but don't take painkillers for a long time. They have effects on kidney, you can get ulcers. So if the pain is very prolonged, then you need to see a specialist. Also very important is that you address the stress. If stress can multiply pain number of times, so it is very important that you remain positive and address stress. If a patient comes to us with back pain, then we normally give him the same treatment. It's basically educating the person about ergonomics, giving him some painkillers, having physiotherapy sessions, and the investigation of choice today is what is called as an MRI scan. It's like a black and white picture of your spine. Simple physiotherapy modalities like traction, IFT, basic exercises can help back pain. Expensive newer gadgets which are marketed very heavily, expensive oils, I don't personally think you need to waste your money on that. In spite of all this, if the patient still has pain, we try what is some called as pain blocks. Maybe in around 60 or 70% of patients, it is helpful. This is done like a daycare procedure. Surgery for back pain is very, very rarely indicated. The other common problem with spine, if you don't take care of your spine properly, is what is called as sciatica. You must have heard this term. Basically, what happens is that jelly-like material of the disc comes out and it presses on the nerve. So you get shooting pain in your leg. You get tingling sensation, numbness, and this can be really very painful.
Sure.
So again, as seen on this MRI, the disc has come out, it's pressing on the nerve. So I would say almost 90% of the patients will get better with rest, analgesics, physiotherapy, and nerve root blocks, which is again like a pain block. Surgery again is not commonly indicated unless there is weakness in the leg or if there is no response to medical treatment. The surgery which we do for such cases is called as discectomy. The disc fragment which has come out, it's a minimally invasive treatment, is just taken off and the nerve root which is pinched is freed. This can be done in modern era with endoscopy. So this is the fragment which has been taken off. There are two small cuts. Again, if you don't take care of your back, some patients may suffer with a condition called spondylolisthesis, where a vertebra slips, and this is treated with a minimally invasive procedure which is called misfusion. So we put in screws in the two vertebrae, pass a rod, and then fix the two vertebrae back into the original position. So here you can see on the X-ray, the vertebra is completely slipped and this is now fixed back in position. The other common problem which a lot of people do ask me is osteoporosis. It is commonly seen in females, especially postmenopausal females. When you're working at home, you're not exposed to sunlight, you are having almost a sedentary lifestyle, especially in the corona epidemic. Nobody is going out for walks, and that going to predispose all of us to osteoporosis. So here you can see what is the normal bone structure is, and in porosis, basically it becomes honeycombed. The choice of investigation is called BMD scan, and in BMD scan, if the level is less than minus 2.5 standard deviation, it is called osteoporosis. How to prevent osteoporosis? For that, you need to have a diet which is rich in calcium. Milk products, paneer, cheese, nachni or ragi, green leafy vegetables, broccoli are rich in calcium. So even if you're working at home, don't binge on junk food and have a diet which is rich in calcium. Again, find some time to walk in sunlight, do brisk walk in your society with the mask on. That will help you to prevent osteoporosis in the long run. If you're smoking, it is very important that it's a very known risk factor for osteoporosis and back pain. Try and give up smoking. And you can take calcium and vitamin D supplements. Actually, vitamin D supplements have shown to be also helpful in corona prevention. And unfortunately, if somebody gets osteoporosis, which is commonly seen in the elderly age group, and get a fracture, then we do what is called as kyphoplasty or vertebroplasty, where we inject bone cement into the vertebra. So to summarize, work from home is going to be new normal for all of us in this corona pandemic. You have to accept that the working environment has changed, and you need to identify at least two places where you can design your own ergonomic workstations. Avoid cluttering your workspace. Keep all other gadgets which can distract you, especially mobile phones, away when you're working. Keep away snacks and drinks. Don't binge on unhealthy food. Eat a nutritious diet. Identify time periods. Make a routine. Discipline yourself and have time periods where you can do the simple exercises which we just showed. You don't need a fancy gym. Simple equipment. Find maybe about 40 minutes in a day to do those simple exercises. So our mission is say no to back pain. This is our website which you can visit. And I thank all of you for attending this webinar and Dr. Prax for giving us this platform. So I now welcome any questions.
Thank you, sir. That was an extremely informative session. I think this is not just relevant to the pandemic now, but even beyond. We see back problems quite prevalent today, especially in the IT genre and IT folks. So I think these were very important, useful tips that everybody is going to take away with. For everybody attending the session, the video will be available on YouTube on our on our YouTube page. So you can refer to that page anytime to see the exercises that Dr. Chaitrali has detailed so well for us. So feel free to go to our YouTube page and check out the exercises even later, even after the session. Okay. So I'll move on to questions. We have a question from Mr. Ravi Bhatt. He has specific questions related to exercises for lumbar disc lesions. So he's asking, I guess, that what exercises can be done for lumbar disc lesions? So, sir, are the exercises?
So, Dr. Chaitrali,
yeah.
Sorry.
Yes, sir.
Dr. Chaitrali will.
Yes, thank you very much for the patients listening and watching the video carefully. Yes, so Mr. Bhatt, if you are suffering from lumbar disc lesions, it's ideally we start with the basic exercises. So it's always better to assess yourself, and then we can start with the exercises like the shown pelvic tilt and the bridges. Then there are variations in those exercises, so it's always good if we first get assessed and then start with the exercises. Thank you.
Thank you, Doctor. The next question we have is from Bhakta Raghavan. The question is, Doctor, are there any specific sleep postures that are harmful to the back or spine?
Sorry, can you repeat that, please?
So the next question is from Mr. Bhakta Raghavan. The question is, are there any specific sleep postures that are harmful to the back or spine? Any specific sleep postures that are harmful to your back? Sleep postures.
Yes. I think basically you should avoid taking too many pillows. A lot of people sleep with 3 or 4 pillows, taking a lot of load. So that is one which is going to be very counteractive. Again, there is a myth that you should sleep on a hard floor on the ground. That is not necessary. You can sleep on a comfortable, medium firm bed. It should not be too soft or spring beds. When we go to hotels, most of us do experience that if you sleep on the spring beds, that is not good for a back. So ideally, if you have a memory foam, basically a memory foam takes the shape of your back, and that is the most useful, but it is expensive. But an ordinary firm mattress will also do. Posture-wise, bending your hips and bending your knees is a very good way to sleep. In womb, when we are in the womb for 9 months, we are sleeping in that couch posture. Avoid keeping your head on your hands and all, because that presses the nerves, and that can give you tingling and numbness. So these things you need to avoid.
Thank you, sir. The next question is from Mr. Sudhir Suryavanshi. The question is, I have developed pain on my fingers, maybe repetitive stress. Can you also say a few words on this issue, as well as can you consult on this? It is the pain. He says the pain comes alive when moving wrist up and down or left or right. So he has a wrist pain that he would like to discuss with you, sir, and see if he can consult with you.
I think wrist problems are very common in people who work for long hours on laptops. If your wrists are not supported, it is going to be a problem. So as Dr. Chaitrali demonstrated in the video, if you have a different mouse and a different keyboard, then you can rest your wrist properly. Otherwise, if your wrists are in an improper position, you're going to get a repetitive stress injury on the wrist. So that what it does is that it increases the pressure in the carpal tunnel, and it presses on the median nerve which goes through the carpal tunnel. So you can get tingling, numbness, you can get pain because of that. So the most important corrective thing to do is to have a proper posture of your wrist. Okay. Again, if you're diabetic or having vitamin B12 deficiency or thyroid deficiency, you are more prone to get this carpal tunnel syndrome. The investigation of choice for diagnosis, if you are having severe symptoms which persist even after correcting your posture, is something called as EMG nerve conduction studies. So with the needles, they test the conduction velocity of the nerve, and that can actually document whether you have this carpal tunnel syndrome. So what we normally do is to give a corrective splint, which can help you correct your posture and maybe give you some vitamin supplements to see if this rectifies the problem. Only in very severe cases where the nerve conduction studies are abnormal, and if there is no response to medical treatment, you might need a small surgery where you release in the carpal tunnel and free the nerve.
Thank you, sir. He also was asking if he can consult with you on this issue.
Yeah, he can consult us for this issue.
Yes, you can reach out to Dr. Amol Rege on Dr. Prax app as well. Download the app and you can add him as one of your doctors and seek his advice. And of course, you can always meet him in his clinic on Law College Road or at the Dinanath Pangeshkar Hospital. The next question is from Monushri Mishra. She says, I have the habit of sleeping with my face on the pillow and later on my neck hurts. Kindly advice. So did you catch that question? She has this habit of sleeping with her face on her pillow. Yeah.
Now, if it is a long-standing habit and if she's used to it, I think it is difficult to correct that habit. But it may not be necessarily be the cause of her neck pain. It may be some other factors like, how she's sitting while working and other things which may cause her the neck pain. So we really need to evaluate as to what is the cause of the pain rather than just sticking the label of her improper posture while sleeping as the cause of her neck pain. It is very common to see that some patients do come with a very severe spasm in their neck if they have slept improperly for one night especially while traveling. That is very common to see. But somebody who is used to sleeping in one particular posture for many years, that is very unlikely to be the cause of a pain.
Okay, thank you, sir. The next question is from Nazia Sayed. Nazia asks, is it okay to have a back massage for, normal, can we normally have a back massage, or even patients suffering from spondylitis? Can they, avail of a back massage, and can they take advantage, will that be helpful for them?
I think Dr. Chaitrali can answer that, and she can also talk about some physiotherapy modalities which are helpful for back and neck pain.
Yes, thank you very much, sir. When there is severe pain, it's better to avoid back massage or any type of massage. It's better in physiotherapy. There are different ways. So in acute pain, it's ideally better if we start with the ice pack or the hot water fermentation along clubbed with the rest and analgesics if required. And once the pain settles, then it is better to join with the core strength training exercises, and then you can club that with the massage. But it's ideally better if you avoid the vigorous massage on the central of the spine from head to tail. It's basically, from the professionals, it's better on the sides of the spine, on the muscular portion. So that is how you can take. And in terms of physiotherapy modalities, there are different ways to reduce the pains. So there is machines like IFT, ultrasound, those we use preferably to reduce the pain. And so your strength is better, and then we can take ahead. Thank you.
Thank you, doctor. The next question we have is from Sachin Adhav. Sachin asks, in the work from home scenario, most of the time we sleep and keep laptop on our stomach. I also add 2 pillows under my knees to make this comfortable. May I continue this posture? I'm already a sciatica patient. So he's like,
Yeah,
we
as I
sleep and
mentioned,
keep, yeah.
yeah.
Yes, sir.
Mr. Sachin, as I mentioned before in my talk, that the independence of home has its own problems. Like you tend to work in improper postures. So when you slip and keep the laptop on your tummy, uh, it becomes like a tummy top. And what happens is that you have to bend your neck to reach to see the laptop. So what happens is you tend to keep two or three pillows. So the whole strain is going to come at your junction between the cervical spine and thoracic spine. And you're likely to develop lower cervical spine problems in the long run. So I think it is better to avoid that posture. And as I mentioned, that make 2 or 3 workstations, maybe a dining table, some desk in your bedroom, and you stick to those workstations when you're working. So I would personally advise strongly to avoid such postures, because that is how maybe you'll not feel it in a month or so, but over the long run, this is going to be counteractive to your spine.
Thank you, sir. So I have one question for you. Actually, you did mention that a calcium-rich diet would be helpful in preventing osteoporosis. But currently, is there any specific foods or diet you would recommend for, improving the strength of our spine?
Yeah. I mean, for people who are vegetarians, milk products, paneer, cheese are a very good source of calcium. Green leafy vegetables, especially broccoli, is a good source of calcium and vitamin D. Then ragi or nachni is a good source of calcium. Those who eat non-veg, fish is an excellent source of calcium. So these are the natural foods which you can include in your diet to prevent osteoporosis. And besides that, if you're postmenopausal, then we advise a calcium tablet daily, because our dietary intake of calcium in Indians is much low than what is normally required. The normal intake should be 1200 milligrams, and our dietary intake of an average Indian of calcium is hardly 400 to 600 milligrams. So some dietary supplement of calcium is beneficial. And vitamin D, ideally you should do your blood test of vitamin D, because just calcium is of no use. You have to have vitamin D also in adequate proportion. So if your vitamin D levels are low, then you need to supplement vitamin D as well. So these are available as tablets, which are taken usually once a week, 60,000 units. And if your level is low, and besides that, sunshine converts our natural vitamin D inactive form to active form. So exposure to sunlight is important. So if you're working from home, think about sitting in sunlight in a gallery. You can have a desk and table and expose yourself to sunlight. That can be of help to improve your osteoporosis.
Great. I think. Thank you, sir. I think that was most helpful. Any other questions that I'm missing out on, Atul? I think we have addressed most of the questions, sir, and we are right on time. It's 6 o'clock, and we've had a very informative session, very useful for everybody. And we all are going to walk away. And I think at least I'm going to come back and refer back to the videos to see
no, I
the
think there was
wonderful
one question
exercises.
around types of TheraBands.
Oh, I'm sorry, I missed that, Atul. Yes, there is a question that I have. I'm so sorry I missed that, Atul. This question is actually from Atul. And what are the different types of TheraBands that are available? Any advice on that? So, ma'am.
There is one more, correct. There's one more question, Vinita.
What are the different types and levels of TheraBands? Is there anything I'm missing? I think I've covered everything else. Yeah, I think we can ask Dr. Gupta to address this, and then we look at the other question that's missing. So, ma'am, what are the different types and levels of TheraBands?
Yes, so there are basically there are various brands in the market. So there are from level 1 to level 5, level 6. And there are
There are a few
specific
questions that have
sports.
come in the chat.
Yes.
So yeah, sure, I'll take it up. Sorry, ma'am. Please go ahead.
Yes. So there are different brands and there are different levels of TheraBand. It starts from level 1 to level 5 or 6. And even in sports, there are different levels. So it's ideally with the pain thing, we usually go from level 1, that is yellow color. So it's better, the VPK brand or Sicily brands are good, ideally when in pain. If we prefer these light brand TheraBands from level 1 like yellow, red, blue, green, and so on, we progress to. There is one other brands like Power Stretch and various TheraBand brand is also there. So according to the pain levels, it's ideally preferred. Thank you.
Sure. Thank you, doctor. There are a couple more questions. Thanks for adding those. The question is from Mr. Lakshman Manjunath. His question is, what is the ideal exposure to sunlight? And I think that it would be, there's a lot of confusion. Is the morning sun good, or is it, should we take the mid-noon sun, or what exactly is the right time, and what is how much time should we spend in the sun? If you could address that, Dr. Rege, that would be useful for all of us.
With the current weather, it's difficult to get any sunlight. But I think ideally at least half an hour of exposure to sunlight is a must. And the clothing is also very important. You should be having a light clothing. If it's too dark and too thick a clothing, you're not going to get exposed to sunlight. And ideally the early morning sunlight, not too early in the day, but maybe around 7:38. After that time is perhaps the best time for your exposure to sunlight. Thank you.
Thank you, sir. The next question is from Bhakta Raghavan. He asks, is it safe for a person with disc prolapse in lower back to work out in the gym?
The disc prolapse, if it is symptomatic, if the patient is having pain, shooting pain in the leg, then I think he should avoid working in the gym. Okay, he needs a rest, basic physiotherapy exercises, and a proper management under expert supervision till his symptoms subsides. Once his symptoms subsides, then slowly he can do graduated exercises back into the gym after telling his gym instructor that he had suffered from this episode of sciatica. It is not that he can never go back to the gym. He can go back to the gym, but once his symptoms have subsided and the doctor has permitted him to go back to the gym.
Okay.
Thank you.
Sure. Any other questions, Atul? I think we have addressed all of them. So, Dr. Amol Rege and Dr. Chaitrali Gupta can be reached out anytime. If you have more questions,
that's
feel
it.
free.
We don't have any.
Okay. Thanks.
Yes,
Thanks,
have.
Atul. Yes. So I would just like to tell our viewers that, they can always download Dr. Prax. Dr. Amol Rege has always been responsive to patient questions. Please reach out to him. If you have any intense problems, you can even take an OPD appointment with him and meet with him and Dr. Chaitrali Gupta. So thank you all for patiently being listening to our to Dr. Rege and Dr. Gupta and posing your questions. And a very big thank you to Dr. Rege, Dr. Gupta. The session has been extremely helpful, and we all are going to walk away feeling empowered to take care of our spine a little more better. I would also like to welcome you to discuss other orthopedic topics in future on Dr. Prax, because I think this is a prevalent issue. Today, there was a question that came up on carpal tunnel. So we would like to welcome you again for more information on orthopedic issues. Thank you once again.
Thank you, Vinita.
Thank you, Vinita.
Thank you. Take care.
Take care.
Hi, Atul. It's still